Hello everyone, welcome to today's webinar. I hope you're all doing well on this very hot sunny day. My name is Michael, and in a few moments I'll be passing you over to today's presenter Helen to talk about medications prescribed for incontinence. But first, a little bit of housekeeping for you all. This webinar is designed for people with knowledge in giving medicines, and it's here to help you further understand your role. If you have any questions throughout the webinar, though, please feel free to ask. There is a Q&A feature as part of the webinar. We will be asking all relevant questions at the end just because of a delay between yourselves and us. But for now, I'll pass you over to Helen, who will explain a little bit about herself and then get into the topic for you.
Hi, and thank you for joining the webinar today. A little bit about me. I've worked for PrimeLife for nearly 4 years, and I'm involved in everything medication, including developing new training packages, audits and email. Previously to joining PrimeLife, I've worked for several pharmacies supporting care homes all over the country. I think of myself as a people person, and I hope that you find this webinar a useful support tool. So let's begin. Today we're looking at medications for incontinence. We will be looking at the generic name and the brand name of these medications. It is important that you know both, as this can often lead to confusion on the MAR chart and the medication being given twice by accident. Incontinence is the inability to control the passing of urine or feces. There are 7 different types of incontinence. Stress urinary incontinence, which means the resident will leak urine when exercising, laughing, coughing, and this is most common in women. Urge urinary incontinence. This is a sudden urge to pass urine. Urge urinary incontinence has different causes, one being enlarged prostate, UTI, or taking in too much fluid. Mixed urinary incontinence is a mixture of both of the above. Overflow urinary incontinence, this is when the bladder cannot be emptied completely and is common with people with diabetes. Neurological bladder disorder, this is when damage has been caused to the brain and is common in our residents with Parkinson's, stroke, trauma or MS. Postmictal run dribble, this is most common in men, involuntary loss of urine shortly after a toilet visit. Functional urinary incontinence, this means that you cannot reach the toilet in time due to impairments such as age-related disability or living environment, clothing, mobility or movement. Medications prescribed for incontinence. People of all ages can have problem controlling their bladder or bowel and have a real impact on their daily lives. Some residents will avoid going out, mixing with others and have a need to plan their activities around a toilet. Residents can be reluctant to talk about bladder or bowel problems due to embarrassment. However, in most cases, the problem can be cured or managed, helping them to retain their dignity and independence. Incontinence can also be caused by other medical conditions. The most common issues associated with incontinence are skin problems, infections, dehydration, loss of dignity, and the risk of falls. Sedatives and continence. Medications that cause drowsiness can affect continence. Prescribed sedatives may mean that the client sleeps through the messages sent from the bladder that urine needs to be passed. Think about your residents' medications. Are they being administered at the right time? So let's think of this scenario. A resident is prescribed sulfasalazine tablets, one to be taken daily, and this is being administered at 8 o'clock in the morning. Staff are finding that the resident is waking in the night distressed with a soiled bed. What could we check? Yeah, we should check to see if the medication is being administered at the right time. In this case, this medication is better administered at night. Remember the 6 rights of your medication training: person, medication, time, dose, route, and the right to refuse. Medications that may affect continence. The ability of the bladder to empty properly may also be affected by certain medications, and this can lead to overflow incontinence. Some of the medications are propranolol for lowering blood pressure, salbutamol for breathing, levodopa for Parkinson's, amitriptyline for pain and depression, chlorpromazine, and mental health medication. Check your residents' medication. Do they take any of these? Bladder infections or UTIs, urinary tract infections. A bladder infection can cause the bladder to be irritated and the need to pass urine frequently. It is important to spot urine infections quickly and speak to the GP. If not treated quickly, it can lead to other long-term problems and confusion in residents. Remember, the resident may not want to go to the toilet as it causes pain and discomfort. Some residents can be on long-term antibiotics for UTIs, such as trimethoprim. Medications for incontinence. The treatment will depend on the type of urinary incontinence the resident has and the severity of the symptoms. If urinary incontinence is caused by an underlying condition, the resident may receive treatment for this alongside incontinence treatment. The most commonly prescribed medications are oxybutynin, known as Ditroban, toltolidine, known as Detrol, dorifenacin, Enablex, festoterodone, Topafex, and sulfenazine, Viscocare. For bowel incontinence, there are 2 main types of medications: loperamide, known as Imodium or Dioxaz, and that's for loose stools, or laxatives, Fibogel, Senna, bisacodyl, and lactulose for constipation. Common medications. Oxybutynin. You may recognise this as the brand name of Ditroban, available in tablet, liquid, patch form, and treats urinary incontinence. An oral syringe should be used for measuring liquid medication, and the tablets are taken orally 2 or 3 times a day. Oxybutynin comes as a patch that is placed on the skin twice a week. Patches should be applied to clean, dry skin on the stomach, hip, or buttocks. Ensure that the patch is covered and not exposed to sunlight. The patch is usually applied twice weekly. Remember to document the application on a body map and a MAR chart. Ditroban is called a loop diuretic, and diuretic medication increases the production and flow of the urine from the body. By removing excess fluid from the body in the afternoon, it may improve the symptoms at night, giving the resident a more comfortable night's sleep, and also reducing the risk of a fall should the resident try to go to the bathroom at night. Check your resident's MAR chart. Is this medication being given morning at tea? Think about your 6 rights and the right time. The resident will usually start taking a low dose to minimise any possible side effects. The dose can be increased until the medication is effective. Remember to document any changes in the care plan and on the MAR chart. Common medications. Tolterodone. You may recognise this as the brand name of Detrol, and it's available in tablets. This medication is taken by mouth and is usually prescribed twice a day. It can be taken before, during, or after a meal. You may not see immediate effect when the medication is first taken, the bladder will need some time to adapt. This is a prolonged release medication, delivering the drug into the bloodstream at a consistent supply, reducing the need to take the medication more frequently. Solifenazine. You may recognise this as the brand name of Visicare. This is available in a tablet form. This is used to treat symptoms of an overactive bladder, and these symptoms include having a strong, sudden urge to urinate without prior warning, having to urinate frequently, or the resident not being able to get to the bathroom in time. This medication is normally taken at night time. Also to think about is your resident's fluid, hydration and the resident's diet. It's important to keep the residents well hydrated. Residents often choose not to drink to reduce the risk of needing to use the toilet. Common medications, Microbagron. You may recognise this as the brand name of Microgo, and it's available in a tablet form. If the previous medications are unsuitable and have not helped urge incontinence or have an unpleasant side effects, you may be offered an alternative medication called Microbagron. You may recognise this medication as Microgo. This medication causes the bladder muscle to relax, which helps the bladder to fill up and store urine. It usually comes as a tablet or capsule that you swallow once daily, and it also can come in a slow release tablet. Slow release medications give a consistent amount of the drug throughout the day, and therefore reduces the amounts of times this medication has to be administered. However, side effects of this medication can include urinary tract infections or UTIs, palpitations and rash. Common medications for bowel incontinence. Bulk forming laxatives work by increasing the bulk or weight of the stool, which in turn stimulates your bowel. The most commonly used is fibrogel, and this will take 2 to 3 days to work, but it is important to increase the fluid intake also. Osmotic laxatives draw water from the rest of the body into the bowel to soften the stool and make it easier to pass. Again, this can take 2 to 3 days to work, and the most commonly used laxative is lactulose. Stimulant laxatives stimulate the muscles that line the gut, helping them to move the stool along to the back passage. These are faster working and take 6 to 12 hours to work, and the most commonly used are Senna and bisacodyl. Softener laxatives. This type of laxative works by letting water into the stool to soften it and make it easier to pass. Docusate is one of the most commonly used of this medication. Some laxatives have to be taken at certain times of the day, such as first thing in the morning or last thing at night. Ensure that the medication is being given at the right time every time. These medications are available in tablet, capsule, liquid, sachets and suppositories forms. Remember to ensure the medication is administered via the right route every time. Advice on the correct route to administer the medication should be documented on the MAR chart. Things to think about. Sometimes residents refuse to take their prescribed medication. Sometimes residents will refuse to take their medication. It could be because the medication is hard to swallow, tastes unpleasant, or causes side effects such as loose stools or constipation. You can usually tell from the person's reaction that they dislike the taste or that the drugs can cause unpleasant side effects. Contact the GP for more advice on alternatives. There are times when a person is more comfortable taking the medication in a particular setting or with the help of a certain member of staff. Think dignity and respect when administrating medications to your residents. If the resident refuses the medication, we can offer the medication later, but this must be documented with the exact time on the MAR chart and does not apply to time-critical medications. Remember, the resident has the right to refuse. It is important to remember to document on the reverse of the MAR chart any results or outcomes if the medication is a PRN or when required medication. Do not be tempted to try hiding medication in food. Medication that is hidden in food is called covert medication and needs to be approved and have written consent in place. This should be documented in the care plan and documented on the MAR chart. Think about your MCA and DOLS training when administering medications. Does the resident have the capacity to refuse to take their medication? If they refuse, try again later. Remember to document and report all non-administered medications and inform the manager. If the medication is refused throughout the day, talk calmly to the resident, explaining the importance of taking the medication and how it will help them before documenting it as refused. Remember, documenting all non-administered medications on the MAR chart is just as important as documenting when a medication is given. This information could be important later. Always remember to wash your hands before and after administering any medications and use the appropriate PPE. Remember to clean the medication trolley before and after each medication round and replenish the medipots, the giving spoons and syringes. Think about your infection control training when administering medication. Additional support. Washing regularly and drying carefully with a soft towel will help to keep skin healthy. Change pads regularly and check the resident's skin. If it becomes broken, speak with your manager as it could lead to a skin infection, causing more pain and discomfort to your resident. Fresh urine should not smell offensive. If it does, there may be a sign of an infection. Raise your concerns to your manager and document. Smell from bowel incontinence is more difficult to hide, and change soiled pads as soon as possible. Remember your infection control training and use the correct PPE. You could look at the bite-sized learning 13, colour-coded laundry and waste. Incontinence can cause other issues including depression, a low self-worth. Remember your dignity and respect training and discuss with your manager before using medication intervention. Perhaps a small change could make a big difference. Encourage the residents to drink normally. Residents should keep hydrated and should aim to drink 6 to 8 cups of liquid each day. Tea, coffee and fizzy drinks can make the symptoms worse. Drinking too many fizzy drinks, alcoholic drinks or drinks with artificial sweeteners in them can also irritate the bladder. Think about other alternatives before contacting the doctor to prescribe a laxative as a when required medication. Constipation or irregular bowel motions can put pressure on the bladder and the bowel and worsen incontinence. Ensure the resident has plenty of fibre-rich foods, including fruit, vegetables, and drinks plenty of liquid. Keep active and exercise regularly. Medication side effects. All the medications discussed have side effects, including headache, constipation, diarrhea, rashes, and sores. Remember to monitor the resident for any changes or reactions that may be caused by the medication and you report your concerns to your manager. Always check the patient information leaflet in the medication box or the BNF book or EMC online for all side effects and medication advice. always inform the supplying doctor and pharmacist if the resident is taking any other medications, including herbal medications, vitamins and supplements, and cold and flu preparations. And remember, if the resident has any allergies, this must be documented on the MAR chart. And do we have any other questions today?
Well, thank you for that, Helen. That was very informative. We have got a couple of questions come through. First one, if a resident is suffering from incontinence issues but isn't on any medication, what should I do?
Okay, firstly, you should speak with your home manager about this. This could be a short-term problem or an underlying health condition. It's really important that we document and record this. And as I say, speak to your manager and speak to the GP about it.
Okay. Do any of the medications that we've spoken about for incontinence, do they interact in any way with other medications?
Yes, they do. As we said previously, you know, all medications react in some way, but always ensure that the allergies are added to the MAR chart and that any intolerance to medications are recorded as well. It could be that, you know, that it could be something quite slight, but it could make a huge difference to a person's progress.
Okay, and the last question that's come through is what alternatives are there to incontinence medications?
What alternatives are there to incontinence medications? Okay, so we would recommend, you know, keeping a fluid and food chart, making sure that the resident is hydrated, regular exercise, weight, watching their weight, obviously keeping a healthy diet, increasing fruit, vegetables, high fibre products as well. That's all really important. Okay.
Perfect, thank you. I'm sure that's really helpful. So thank you everybody for watching today. If anyone does have any questions, how can they get hold of you, Helen?
Hi, yeah, not a problem. I can be contacted on Helen Berridge at prime-life.co.uk, or you can just call me on 07917 045 483.
Brilliant, and thank you again everyone for watching and taking part today, and we'll see you again in a couple of weeks.
Thank you.
Bye now.
Bye.